Hello, everyone. I'm Şevval Karadağ. I'm a medical doctor and entrepreneur from Istanbul, Turkey. And today I will talk about training the medical professionals for tomorrow. I founded several startups through my career, and I'm actively working on two of them. One of them is Medipreneurs Turkey Association, which is actually a social enterprise, an NGO. We provide support network to the medical professionals to collaborate with interdisciplinary experts in order to foster innovation and collaboration, because most of the time medical professionals are isolated from the innovation and entrepreneurship ecosystem. And this is the challenge that we want to tackle. And the second one is Viva Smart Care, which is a remote monitoring startup specialized in elderly people's needs. And today's I will talk about more about the, what is the future of healthcare and how can medical professionals best prepare to this future. So this presentation is not about future of medical education, okay? It's more about what is the future of healthcare and how can we prepare the medical professionals to it, not only based on the medical education. So in the first half of the presentation, I will talk about what does tomorrow hold in healthcare, quite briefly. And then we will evaluate how is the current situation. And then we will talk about ways to improve adapting these new technologies, this tomorrow to today. So I just categorize 5 topics for the future of healthcare. One of them is IoT-assisted wearables. And when I mean wearables, I'm not just talking about wellness devices that we use commonly. I'm talking about medical-grade devices. So these wearables has certification from FDA or EU MDR from Europe, which means that their measurements are parallel to the medical devices that measures in hospitals. And we can, give some examples. One can be the smartwatches and smart bracelets, which are measuring the vital signs, which are oxygen saturation, respiratory rate, heart rate, and blood pressure. And biopatches are better for vitals than EKG, which is important for people who has chronic arrhythmia, because these biopatches alarms medical professionals or the patient's relatives when it detects in lethal arrhythmia or calls an ambulance to intervene the lethal situation right away. And there are smart textiles and smart rings, which are basically, doing the similar things. They're measuring the vital signs in EKG, rhythm of the heart. And I'm actually in Germany now. I attended the Medica Fair, which is like one of the largest healthcare technology fairs. And I saw some contactless vital monitoring technologies, which is you're now, the camera is looking at your face, and then it measures your respiratory rate, oxygen saturation, your heart rate, just from your picture on the camera, which was insane. And they also have certification for a medical device. So the measurements are, the clinical trials have been done and measurements are found out to be parallel to the medical devices that measures in the hospital. So which was very exciting for me. And there are some pill cameras, which are IoT-assisted cameras that can replace or ease the process of endoscopy or colonoscopy in patients. Second one is artificial intelligence, which is a very hot topic nowadays. How can these systems help us? We will get a lot of biodata from the wearables, and we have to interpret this data. So AI can help us, process this data and help us, support the diagnosis. By meaning us, I'm meaning the doctors and the medical professionals. And in radiology, there are image processing systems that can, suggest a diagnosis through the scanning from the CT devices, MRI devices, or in X-ray. So you can suggest the diagnosis, which could be really helpful to the radiologist. And the predictive and preventive medicine, which could be more helpful in, let's say, infectious diseases or in public health situations like in pandemics. There are news, maybe you read it as well, that one AI company from Canada just reviewed the literature, and the AI could predict that there might be a pandemic of respiratory tract infection in 2020. Which is an example of predictive medicine. And there will be a lot of data coming from wearables as well, through the remote monitoring. Also, AI could help medical professionals to make a, predictive diagnosis. And the third one is medtech innovations, which are mostly include robotic systems that are used commonly. For instance, robotic surgical systems. Da Vinci is being the most famous of them. And there are some neurostimulators for Parkinson's disease and Alzheimer's disease. And there are some implantable pacemakers where doctor can remotely regulate the device and could send shock into the little arrhythmias. And there are some implantable drug delivery systems, mostly used in oncology. And the third one is precision medicine and biotechnology. We can give some examples again. Pharmacogenetics, which means, designing drugs based on your gene analysis that will, having ingredients that help you to get the most of the drug. It will get you the most highest benefit from the treatment. And through gene mapping, we can now predict the long-term diseases. Let's say how many % you have chance to get a colorectal cancer through your gene analysis. And once we understand that, we can suggest some preventive measures quite early on, for instance. And there are some developments in regenerative medicine, which means production of artificial tissues, which could really revolutionize the wound cares. And finally, telehealth and remote monitoring infrastructures, which are actually the baseline of all of these technologies, because it helps the smart devices and medical professionals to connect with each other, because the device is gathering data and it goes to the cloud system, and there's some computing systems in the cloud which are mostly AI systems. And then that data then processed through the computing system, and then the professionals can see the data and make decision based on it. So it's actually creating a baseline for these technologies. So let's make a quick review of the history in the healthcare systems. So in the 1990s, there was a paternalistic care, which means that you admit to the doctor, but you know very, very less about your health. And you just don't ask too much questions. You just go and doctors examine you, and you do whatever the doctor says because you have very high trust to the doctor. So this is a paternalistic care, which means that you trust the doctor so much that you don't even ask questions. And the second one is where the patient becomes starting more a bit in the center, which are like in close to 2007, 2010. So you go to the doctor when you have symptoms, when you are sick. You go to the doctor when you are sick, and then doctor prescribes some drugs to you, but you're now more aware of your situation. So you're now a bit more involved in your health situation, which is called Healthcare 2.0. And in Healthcare 3.0, which is close to today, we can say like after 2015 and onwards today, which the patients become more in the center, and now the government systems support the preventive medicine. So they say that you should go and do your screenings early on to prevent the diseases or intervene the risky situations early. So then you don't only go to the doctor only when you're sick, you also go to the doctor when you to your controls to have the screenings. And then you get more engagement from the healthcare team. And the future, which is the technologies that I mentioned in the previous slide, called Healthcare 4.0, where through these smart devices and new technologies, you got remotely monitored. And then through the data that coming from these devices, AI can, alarm the medical professionals if they predict a risky situation. And again, with the AI, there will be some support to medical professionals for diagnosis, which are called recommender systems. Also, some suggestion for the treatments as well. And through the precision medicine and biotechnology, there will be personalized healthcare that you get your drug specialized for you. The treatments will be specialized for you. This is the quick summary. So I mentioned about the technologies, but now let's discuss how this tomorrow might impact the healthcare services. The first one is interoperability. Let's say you're a citizen in Bulgaria or in Turkey, and you go to another country and you start to feel unwell, so you admit to the hospital. And they're let's say they think that you have infection and they prescribe some antibiotics, where you might have very little allergy to antibiotics, but they can't see this from your records, because records are only working in their country's own system, and even sometimes only on that hospital or that hospital group. So which lacks the interoperability, but through this infrastructure telehealth provides, now it will be easier for medical professionals to see these records and share the treatments records of the person. And also through blockchain, it will be more secure. And there are lots of laws developing about the medical records or medical information transfer systems. So there are now some systems that help us to share this data more securely. So these technologies will allow us to more interoperable in healthcare. And the second one is the decentralization of service delivery. Because now, today, when we have some symptoms, we just go to the hospital. Hospitals are the center of the healthcare service. But even today's, there's more demand from the patients to get the treatments at their house. So this remote monitoring system, remote diagnostic systems, which we discussed, let's say through wearables that share the vital signs or the healthcare parameters, 724, and sharing those real time with the medical professionals. So when there's a risky situation, you have alarms, specialized alarms, and you can intervene quite fast. So the homes will be the new centers of the healthcare service delivery, and for that it will be like a huge change in the current systems. But these technologies that we just discussed will allow us to change the center of the healthcare services. And the third one is effective time management for the medical staff. Because now they're like huge workload of the medical professionals. They have night shifts, and in Turkey especially, they work around 18 hours in a day, or with the shifts, it's like too much workload, and there's still medical staff shortage in a lot of countries. So with AI and with these smart devices, for instance, maybe this might be more prominent in near future in radiology, medical staff will have more time to make some research, work on innovation and doing activities that will support their creativity. And the fourth one is personalized medicine, because now the medical systems are based on, standard treatments based on the diseases. This is the disease and this is the drug you prescribe into that diseases, and doses are based on measurements of these parameters and these numbers. So it's actually quite standard and based on the diseases. But with the pharmacogenetics, for instance, or gene mapping, or through remote monitoring, you will get the new normal of the patients. For instance, let's say blood pressure is accepted as 80 to 120 as normal. Most of the time, they change it to a hypertension level to 90 to 140 lately. But this is not actually correct for everyone. Some people's normal levels are lower some people have higher normals. So it shouldn't give the same hypertension alarm with every patient. It should be more personalized. And now we have technology to make this happen. Okay, we discussed the technology and we discussed how this will affect the healthcare services. And let's ask the most important question. Are we making the most of available technology? Because these topics are discussed heavily in several, health tech forums or healthcare innovation conferences. But what is the current situation? In my first company that I didn't put it into the introduction, which was Fortuna Healing Innovations, what we do is we were designing projects for hospitals or for clinics, for insurance companies about healthcare. And there we see that there is a huge gap between medical professionals and the technology that are existed. Let's look at this. So there's one quote from a research. In US, 66% of the hospitals, they provide applications to their patient where they can, record and, see their results or interact with their doctors, but only 2% of the patients are active on them. This doesn't mean that patients are against the applications, because we're this is a recent study. This is done in 2022. This means that hospitals are having difficulty in engaging their patients and medical professionals through making communication with the digital systems because it's not designing based on the needs or habits of the patients and medical professionals. And let's discuss a few reasons that might create some less adaptation from medical professionals or patients. Of the technology. One of them is workload impact, which means that engineers or the social science experts, they work together and they create a technology. They think that this will help a lot to the medical professionals, but in reality, it makes the doctor or nurses to even make more steps. Click on more buttons, or it will add even more intermediary steps. So normally they do it, let's say, in 10 seconds. But with this new technology, yes, the technology is very good, but it will take 30 seconds of the doctors. And that's why they don't use it. I think one of the reasons that this happens is that because medical professionals are not much included in designing and creating these new technologies in healthcare. They are in position of consumers. Medical professionals are mostly consume the new technology and they're not much involved in a production of this new technology. And this is why most of the startups, unfortunately, create the technology which makes even more workload for the medical professional, and it creates less adaptation. And I've seen in my experience, for instance, and fortunately they're like engineers are like doctors are against innovation. They just prevent us to do a really good job. We make too much effort to create very good technology, but they don't even use it. It's not because of that. It's because they're not engaging from the beginning, and they're actually having more steps even completing the task. And the second one is training and the familiarity. So what I observe from the hospitals, both as a doctor and as a consultant to create designing projects for the hospital, is that managers are the one who decide which technology to use in the hospitals, but they don't really give training to the actual medical professional that use the system, which are, let's say, technicians, which are nurses. Head of departments can get the training. Some doctors get the training, but they're not the one who actually use the devices all the time. So the medical professional who use the devices should get the training, and this should be like a culture in these corporates. So this is why there are some poor onboarding processes to the new technologies, and it will create less adaptation of the new available innovations from the medical professionals. So third one is the environment and the infrastructures of the clinics. So I was at one of the, let's A+ hospital in Turkey, which one of the best hospitals in Turkey. Yes, doctors are like very successful and their highest technology used in imaging systems, in surgeries. But when you get a virtual appointment, what they do is they decide a phone to take this calls for doctors. And if the patients taken virtual appointment, they just, take this phone to the doctors and they open WhatsApp. I'm serious. They open WhatsApp and they talk. They make video conference through WhatsApp. So, and this is one of the best hospitals. I'm not saying this to, shaming my own country's hospital. I'm just saying there should be better designing systems for this type of virtual appointments. And later on, they created a website and the application to make the virtual appointments. But then in reality, there are many errors when they try to make it. Let's say the camera won't work. There is a problem with the mic and on and on. So these, unfortunately, events make less adaptation of these technologies and create a resistance, create some judgment from medical professionals towards technology, unfortunately. And the fourth one is two of the major problems in the medical industry is that there are lack of interaction between medical professionals to tech professionals. And this innovation and entrepreneurship ecosystems are mostly involving these two experts, but excluding the medical professionals. So this is why it's more difficult for medical professionals to adapt the system. If they would be included from the beginning, if they would be engaged from the beginning, what I mean beginning is just designing, just brainstorming the new technology, they would be more owner. They would feel more owner of this new service and new technology, and they would use it a lot frequently than now. So these are the two of the most important problems in the medical industry now. Okay. So what can we do to increase adaptation of these technologies by medical professional? Is that now we can suggest some solutions to the universities because in medical education, like almost all of the lectures are based on medical knowledge, but we need to add more, lectures about innovation and entrepreneurship in the academic settings. This should be more encouraged to the students, and we should, create interdisciplinary environment for medical professionals, medical students, pharmacy students, nursing students to go and connect with the tech professionals. The professionals from other fields, they should, connect, so they should collaborate so that they could, create an idea, create a really good prototype. And, they should also be connected to the entrepreneurship ecosystem where they find investments. So this is very important. And the another suggestion is to adding lectures about, maximizing the potential of AI. For instance, ChatGPT recently really, affected our lives because it's very easy to use and it's free. And I tried myself a lot. And you can, ask about the symptoms and, ask for an potential, diagnosis. You can ask about the treatments, and you can ask about how can I communicate with this type of patients. You can even, ask those questions. But, in order to get maximized most of the benefit from the ChatGPT, you have to learn to ask right questions. There's some tricks to ask more correct questions to get most of the AI. So even this is a skill, and this skill training should add it to the medical training. The last one is, we have as medical professionals very, less knowledge about technology literacy. Most of us still just, when we have a problem with any technology device, I sometimes, including myself, what we do is we try to just open the device, close the device and open it again, and we hope that it will fix. So this is not gonna be a sustainable way for medical professionals to adapt new technologies. So we have to add some lectures about technology literacy. And as Medipreneurs in Turkey, how do we contribute? We have members of 169, and these are, some of them are students, some of them are medical professionals, some of them are engineers. It's very interdisciplinary. And we also have a mentorship network, and we have mentors again from medical experts, tech experts, and investors and entrepreneurs. And also these members of 169 members, 30 of them, more than 30 of them, has their own startups. And we follow the improvement process of those startups, and we do our best to support their needs. So what do? We are designing tailored digital innovation programs for medical professionals. And sometimes for that, we got the demand, and then we got partner up, and then we designed a specific training. And we are, exposing the medical professionals and students to the entrepreneurship ecosystem. So we invite investors, and we invite, good examples, best examples that, that these are the people who are both medical professionals, are also successful entrepreneurs. So we invite them to the meetups, and we, help creating connections with our members and with our mentors. And lastly, we generate training opportunities through hackathons. For instance, we did one in this February when we had the earthquake in Turkey. It was about preventing the infectious diseases and supporting the public health after the earthquake. And these are the things that we do now, and we are constantly just, finding new ways to support it. And we are very open to collaboration and partnerships. And these are a few pictures of what we do. These are pictures from the hackathons and through our meetups. And we did a summit for Medipreneurs Entrepreneurial Summit, which is like a entrepreneurship in healthcare summit. And lastly, I'm saying we can heal together. And thank you for listening to me.